Thanks so much.
Good morning, everyone. So our numbers for today, we have 781 new confirmed cases, as well as 204 new probable cases. Of those, 53 are new hospitalizations. We have 36 new deaths that we're reporting as well. We have 1,584 newly recovered individuals, and total new tests that have been reported in the past 24 hours, 6,342. This does bring our total COVID-19 case counts to 81,280 total confirmed cases and 6,743 total probable cases. Of those, we still have 16,148 individuals who still have active infections, but we have had 70,728 individuals who have recovered and are no longer able to transmit COVID-19. We have a total of 501 individuals who are currently hospitalized, and our death total is now 1,147. We have had a total number of tests reported of 659,619, and that is among 344,472 unique persons. I did want to note that we did have one update in residency on the dashboard that you'll see for one of the deaths. That is a Lincoln County case death that was reclassified to Minnehaha County. So you will see that noted in the current dashboard updates. And with that, I'll turn it over to Secretary Malcolm Ryston.
Thank you, Dr. Clayton. So I'm happy to report that we are hearing more and more about vaccine availability. So I just wanted to remind everybody that the FDA will be meeting tomorrow to consider the emergency use authorization for the Pfizer vaccine. The state's allocation for that vaccine has been set at 7,800 doses. And just as a reminder, that means we'll be able to vaccinate 7,800 individuals because the federal government will make sure that we see the second dose for that same group come 3 to 4 weeks later. We've also been provided information about the Moderna vaccine, and so that is the second vaccine that is being considered for emergency use authorization. For that vaccine, the FDA will meet for approval consideration on December 17th, so a week from tomorrow, and the state's allocation of that vaccine will be 14,600 doses. And again, like with the first vaccine, the federal government will reserve the second 14,600 doses for that two-course series. And so with the first allocation, we'll be able to vaccinate 7,800 people, and with the second allocation, we'll be able to vaccinate 14,600 people. Just to, again, refresh everybody's memories, where we will be starting with allocation and vaccination will be with staff who are taking care of COVID patients in ICU settings, acute care hospital settings, and hospital emergency room settings. So that will be the first population that we start with, as well as long-term care employees. Once we get through that group, of which there's approximately 19,000 people in the state, we will then move to long-term care residents to ensure that we're getting to not only that healthcare workforce, but those very vulnerable individuals. Among the long-term care residents, we estimate there is approximately 11,000 individuals there. So we're optimistic about vaccines and excited to be ready to deploy those, and those will be the groups that we start with. Once we get through those groups, then we will be allocating vaccine towards all other healthcare professionals, first responders, and critical infrastructure employees.
Okay. I am going to unmute the phone lines, and we will start with questions. Can we please have our first question? First question, please.
Chairman Hugler, I'm Ben Chase with the Plainsman.
I heard Ben with the Plainsman.
Yes, I noticed we've had a notable downturn in active cases, and just curious, I had talked with a couple weeks ago regarding the texts and emails, and I talked with a couple of folks through the department, and just curious how that is going, and if that has had some effect on the downturn and the increase in recovered cases that we've seen across the state, and if you guys could speak to that. The technology as far as the surveys and whatnot. Sorry.
Yeah, certainly. This is Dr. Clayton, and we have provided notification either via text message or email to approximately 15,000 individuals who had tested positive for COVID-19. And so our response rate to those notifications has been approximately 45% of individuals who have responded and completed either in partial or in full the questions that we asked them, including to notify us of their close contacts. And so those, I would say that based on what we're hearing from some of our national partners in other states, that response rate is very high compared to other states that also started to use information technology.
So I think this is Secretary Malcolm-Rice, and I would just add to that in that, people in South Dakota have been great to work with. We have not encountered, some of the issues that other states have relative to people not working with us to complete the investigation process or to identify close contacts, and that is a very important part of our response.
If I could follow up on that, is this something that you would then want to expand further as far as using that technology aspect further as in notifying and following up with positive cases?
So we are already looking to expand, the use of that technology to do notifications specifically for close contacts who have been named by cases. And we're also looking. We continue to look for ways to both streamline, the process for us as well as for individuals in the general public. I think one of the advantages that the reach out to cases has been using the text messaging and using email is that they can complete that information, at any point, in the days following that notice. So, we do. I think because individuals can sit down after work and not the phone call from some of our staff, I think that is a very important part of why we have seen success with the use of this technology, and that we are looking at ways to expand that as well. Thank you.
Okay, can we please?
Great, thank you.
Next question.
Todd Epp, Kello.com News.
Go ahead, Todd.
Thank you. In yesterday's budget address, Governor Noem again made the allegation that the media is not properly representing the situation with the coronavirus in our state. Have you all briefed her on the numbers? Where is the local and national reporting going astray about our situation in South Dakota?
Todd, this is Secretary Malcolm-Rice, and so we provide a daily update to Governor Noem and the team at the Governor's office, as well as the Department of Health that is, obviously been working this response for months. And so what I would tell you is that, I think the references to the media coverage are referencing some national media outlets that are selectively looking at certain data points that really are part of an agenda that they have that is not necessarily fair and balanced.
Next question.
So if I could
Abby
follow
Varga
up,
with the Capital Journal.
If I could follow up, please, for just a minute.
Yes, please.
Okay. Yes. So briefly, then. So what exactly do you think has been misrepresented? I mean, what data points do you think are not being properly represented or interpreted in the national media?
Well, I think, you know, the thing that comes to mind most readily would be about hospital utilization and capacity. And so, again, I'll just remind everybody here that the data that's on the Department of Health website and the covid.sd.gov website is the data that's provided by health facilities themselves about staffed bed capacity. And so to insinuate that there is not capacity to take care of people in South Dakota hospitals just is not correct. The data doesn't show it, and you know, I think that's you know, that's a storyline that has just not been accurately portrayed.
Okay, I believe our...
Thank you.
You're welcome.
Yep, I believe our next question was from Abby with the Capital City Journal.
The Capital Journal, yes, thank you. So sort of going along with selective data, I'm wondering about test positivity rates. The Department of Health and the CDC sort of report differently than Johns Hopkins does, and I know that a lot of major news outlets have been using Johns Hopkins rather than the CDC. So looking at the Department of Health, the South Dakota Department of Health numbers, the cumulative average of test positivity rates is showing around like 12.5%, whereas the 7-day moving average that Johns Hopkins is reporting for our state is around 51.2%. So I was just wondering if you could sort of explain the huge discrepancy between those two numbers, and sort of like how you guys are computing test positivity rate in comparison to how other organizations are, if that makes sense.
Yeah, absolutely. Thank you, Abby, for that question. We have talked about this a few weeks ago, I think, but just to maybe frame this appropriately, the South Dakota Department of Health and the CDC actually use the same methodology, and so that's what you will see with the CDC test positivity rate is the way that we also calculate that. The other thing, and so the Johns Hopkins data is actually calculated on, you know, using a different methodology. One of the reasons that is the case is because Johns Hopkins doesn't have access to all of the data points needed to be able to report the test positivity rate based on the PCR test, both numerators and denominators. But I'll let Josh get into some of the details around how this is calculated.
Yeah, so thank you for the question. And what I would say is that, as Secretary Malsom Risden mentioned, that, you know, we do have, we are the entity that receives all of the positive and negative reports. And so the information that we provide on our website and that we provide the CDC is really providing that most, I guess, pertinent way of defining that in the absence of some of that information, which if you'll see on Johns Hopkins website, they actually point to using multiple different ways in order to calculate percent test positivity across multiple states. That is because there is no national, single national way of representing that data, having all of that data listed on those websites. But for the South Dakota Department of Health, we use the in a 24-hour period. So this would be our data cut of 1 p.m. The previous day to the 1 p.m. Yesterday. So one example is for today's numbers, we cut the data at 1 p.m. on Monday through 1 p.m. Yesterday, and that is what we're reporting out today. That includes the apologies. That includes the full testing that was done, on Monday. So that includes all positive PCR-based tests that were reported to us over the total number of PCR-based tests, those molecular tests that were reported on Monday. So that's a full 24-hour period. Johns Hopkins, in part, uses the data that is reported on the reporting websites. So that is first going to be a difference in the timing in which they're pulling the data. And so they would be using not a full calendar day, but a 24-hour period from 1 p.m. to 1 p.m. And some of the other issues are that they are looking at the total number of persons who were positive in that period, over a denominator of, total persons, I think, tested is how they're approaching it. So it is important to note that when you're looking for the most accurate information regarding percent test positivity, that the South Dakota Department of Health is going to show that information a couple different ways. So we have it as 1 day, 7 day, and last 14 day, as well as cumulatively. So those 4 different ways to look at that test positivity. And then the CDC website uses that same calculation because we do report anonymously the tests that have been done in the state of South Dakota, so they can also calculate that and post it to their website.
Okay, can we have the next
Morgan
question,
at the
please?
Rapid Regional.
Go ahead, Morgan.
I just wanted to double check one thing. Is the 19,000 figure that you gave earlier referring to the population of frontline healthcare workers and long-term care employees, or just one of those groups? And then I also wanted to ask if any healthcare workers will be required or mandated to get the vaccines, or if they have a choice to opt out.
Thank you, Morgan. So the 19,000 does include both long-term care facility care workers and those frontline healthcare workers working in those COVID patient units. And relative to requirements, certainly that's not going to be something that we do at the state level. Employers might, look at that differently, and so you would want to check with specific employers to see if they're going to be requiring employees to get the COVID shot.
Okay, next question, please.
Jeremy Sugelberg, Foreign Service.
I heard Jeremy.
Yeah, first, welcome, Daniel. And second, I'm asking about the Moderna vaccine. So we've got numbers on that. Do you have a sense of timing for when those vaccines would be available in South Dakota to distribute?
Sure. So what we know about the timing, Jeremy, is that once the FDA does provide the emergency use authorization, so that EUA, that Operation Warp Speed, so that's the federal group that is, kind of managing this entire operation in terms of allocation to states, that they will be looking to ship that out as soon as possible. We're hearing, even within 24 to 48 hours. They have asked states for locations for where these vaccines can be drop shipped so that they can be deployed as quickly as possible. And so as we have updates on more finite timing, we'll be sure to share that.
I believe Ray had a question.
Yeah, thank you. Just related to the distribution of the vaccines, temperature and timing seem to be key on this, and you mentioned drop sites. Can you give us a little idea of how some of these, how it's going to be transported to, say, maybe Mitchell or Lemon, South Dakota, or Wagner, South Dakota? I mean, are we looking at plane or fast truck or what?
Sure. So thank you for that question, Ray. So yeah, so the Pfizer vaccine in particular, that's the one that has the ultra cold storage requirement. And so we need to make sure that we are very much paying attention to some of those logistics to ensure that we don't have any problems maintaining that ultra cold storage. So there's a couple of ways that ultra cold storage can be maintained. First of all, these vaccines will be shipped in containers that contain pelletized dry ice. And if you didn't know, there's different kinds of dry ice. That's something we learned here. And so that dry ice, obviously will maintain that ultra cold temperature through the time that it is shipped. It will be flown in to the state. And so upon arriving in South Dakota, we do have, adequate ultra-cold storage facilities to maintain that ultra-cold storage temperature. When we are looking to deploy that particular vaccine to areas where there is not that ultra-cold storage available, then we are looking at the dry ice option to maintain its viability. The Moderna vaccine does not have the same requirement, and so it is easier to deploy to areas that don't have that ultra-cold storage, and so that makes that a more viable option for some of the more remote communities. Back to your question about transportation, we are in the process of discussions with the Civil Air Patrol to help us transport some of these products and just, again, have a very well-coordinated and make sure that we're using those kinds of resources to get vaccine out to people. And so it's really been a great experience. I'll tell you, we've just got lots of people that want to help with this, and I'm really optimistic that we'll be successful with this.
Okay, can we get the next question?
Jack Cottle, KEBN and KODA.
I heard Jack.
It's been a while since we've seen the big case number days, the 2,000 days. What, if anything, do you read into that at this point?
This is Dr. Clayton. You know, what I would say, and we discussed this a little bit on last week's briefing, is that, you know, we have seen a downward trend in our total number of cases that we were reporting out on a daily basis. You know, I would be cautious in how we're discussing this because, you know, we still may see a little bit of an increase post-Thanksgiving holiday. You know, we are coming up on the Christmas holiday as well, and I think that there are opportunities for ongoing spread of COVID-19 with those events. And so really the takeaway is that we all need to remain vigilant to prevent transmission within our community, and that we will report out the information that we're receiving, and you know, so far that has been positive.
Okay, next question, please.
This is Stephen Groves with AP.
Go ahead, Stephen.
I had a follow-up question on the positivity rate data reporting. I'm wondering if Johns Hopkins has access to the data that Department of Health provides to CDC. You had mentioned that they're not looking at the same data. And if they don't have access to that, is that publicly available, and why or why isn't it publicly available?
This is Dr. Clayton again. We do provide some of the information that would be needed for them to calculate very closely to how we're calculating the test positivity rate. Not all of that data is available on the Department of Health webpage. It's just not something that you know, people have asked for or use on a regular basis. We've you know, we've not had a specific request from Johns Hopkins to change that. You know, when we're looking at, again, if you take a look at their website and how they're reporting for several different states, this is a common issue that they're having, you know, in terms of being a secondary reporter of some of that data. And so they are, you know, taking the data that is available on the websites so that they can provide some level of national comparison. But one of the key things I would like to point individuals' attention to is that CDC has enhanced their reporting on their CDC COVID tracker. And so there is more information available on test positivity rate than there had been previously. And so I would direct individuals to take a look at and start using the information on CDC's website.
Okay, next question, please.
This is Kelly Hertz from the Press and Dakota.
Go ahead, Kelly.
I was wondering if anyone from the Department of Health or the state had contact with the Biden transition team yet, because it sounds like they want to really hit the ground running next month. Has there been any contact at all between the state and that transition team?
Well, Kelly, I can speak to COVID, and I do know that there's been a request for information of all states around the vaccination plans that states have, and as you know, we've got our plan out on our website, and so I know that there has been a contact regarding that issue.
Okay. We have time for one more question. Last question, please.
Gordon with the Alcester Union.
Go ahead, Gordon.
All right, so 8,000 approximately doses are next week, and the following week, 15,000. What are you projecting down the road? I'm kind of wondering, when are we going to come out of the forest here with regards to immunization vaccine for citizens of South Dakota?
Well, Gordon, that's a great question. Unfortunately, we do not know what our subsequent week allocations will be. So just a couple of notes about that. So the way the federal government is allocating vaccine is based on what they have available to them. They are allocating it to each state based on population, okay? So we are getting a commensurate amount of vaccine, you know, with our population compared to other states. What we do know is that these initial allocations, again, of 7,800 of the Pfizer and 14,600 of the Moderna, are likely to be larger than what we will see in subsequent weeks. And so as soon as we have that information available, we will, you know, again, let all of you know. We are currently, I'll just give you a heads up, working on a vaccine tab to the dashboard so that you will be able to see kind of what we're being allocated and where it is being allocated, you know, to the population of South Dakota. So we're looking forward to being able to share that information. And again, you know, kind of big picture, all the indications that we have is that it's likely to be April or May before the vaccine is widely available to the public outside of those initial populations.
Okay.
Thank
We
you.
would like.
You're welcome.